Hi, and welcome to this Spark Session recording. My name is Allison George, and I am representing the training team here at the Maternal Health Learning and Innovation Center, and I'm excited to be sharing a presentation and discussion with Amy Hatterer of Motherboard Birth, who is going to tell us about her exciting innovation to reach women and pregnant people and families. And I'm just going to let you take it away and tell us what you're doing.
Awesome. Thank you so much for having me here. I'm really excited to be a part of this conversation as well. So I'm going to go ahead and share my presentation real fast. So as you said, we are Motherboard Birth. We're improving birth via education, communication, and informed choice. So a little bit about me. I am a birth doula. So I have been supporting families throughout their birth process for about 12 years now, hundreds of families in the Denver area. I'm really passionate about helping birthing families. This became deeply personal to me when one of my really dear friends, Rebecca, almost bled to death in the emergency room of a postpartum hemorrhage. And she was very much advocating for the care that she needed and was not listened to. So it's really important for me personally and professionally to help bridge the gap and aid better communication between families and their birth team. As some of you might know, the maternity care is really in crisis in the United States. We have the worst rate of maternal deaths in the developed world, and instead of declining, like a lot of other countries are steadily declining, ours is actually on the rise. And to talk further about that, we have an iceberg effect, right? So for every one person who dies during childbirth, 70 people almost die. And this is from the Alliance for Innovation in Maternal Health and ACOG. Also, Black women are 3 to 4 times more likely to die during birth. And furthermore, a third of people after their birth experience describe their births as traumatic. So this is just a visual of the problem that we're trying to solve. So the way Motherboard is impacting this is through 3 core products. We have a visual birth plan dashboard, which I'll show you in a minute. And then we have online childbirth education. We have a dashboard for educators in any capacity to be able to give trauma-informed, diverse, inclusive childbirth ed. And then we have prototyped an iDecide care provider tool, which I'll get into in a minute. So what I'm going to do is show you our parent app real fast. Let me share my screen so you can kind of see the back end of what we're doing. So this is the Motherboard Dashboard. This is what parents would see when they sign on to our app. The information and the content is really geared around decisions that they will likely need to make during their birth process. So when they start off, they can create either a vaginal or cesarean board. We really encourage people to make both because you never know what's going to happen. So give it a title, give it a color. And once this board is created, it'll be blank because you have not added any options to it. But for example, if you want to learn more about what you want to do for induction, you can click on induction and it lays out the information in a really brief form at the top. And then there's a dig deeper part of more information that they might need. And then there's benefits and risks for each type of induction. So for example, natural induction or mechanical induction, there's benefits and risks for things like Foley inductions and all of that, as well as benefits and risks for Pitocin, Cytotec, all of that stuff. So once they've educated themselves on what they want to do, they would select their option over here, and then there's a little check mark saying that that's been added to their board. So as you can see, there's tons of information. You can select so many different options, but then when you are going back into your board, what you need to do is take all the options that you've selected and prioritize them. So you would pin them to your board this way. So for example, this is one that's a bit more filled out. This is a sample board that I created. So if you kind of collapse all these things, this is what your board will look like when you export it. But you can expand it and maybe, okay, so perhaps you, you had decided that you wanted to do a mechanical induction, so you can change that over here and it will change up here if you've prioritized it. So there's 3 ways that you can share your board. The first is just to download it. So if you click this little blue download button, it will export as this lovely PDF that you can print and take to labor and delivery with you when you have your baby. So this is like a snapshot in time. And then you can also share via email. So this would be sharing the PDF with anybody that you want. And then the most innovative and interactive way to share your board is by adding somebody to your team. This could be your doula, your care provider, your partner, your mother-in-law, whoever you want to be able to see all of your preferences in real time. So they would be able to not only see what you've prioritized in these 15 options in the baby meds, but also expand it and see all of the options that you've selected. So this is really helpful for doulas, care providers, OB nurse navigators, which is kind of a new thing that's happening now, where people or nurse navigators will discuss with parents what their birth plan is, what their priorities are prenatally. So we're helping parents really understand their options and communicate with their care team effectively. And then just going back into my slideshow here. So then the other tool that we're building to bridge the gap, so that's the parent tool. And the other tool that we're using or building is called iDecide. It's a care provider tool. So we have information that providers can use either in clinic or at the bedside to really level the playing field, streamline the information, and take some burden off of their time to be like, this is your cervix on drugs. So they would be able to use this in clinic and at the bedside, and also give access to families to go through information on their own if they desire. And then we can also enhance discharge instructions, because as a lot of us know, there's a lot of people that have complications and even die in the postpartum period. So this would be a way to enhance discharge instructions that's not a handout that might get left or thrown out. We really compare what healthy postpartum looks like versus warning signs and when to come back in for care, and also what a healthy baby looks like and warning signs for your care provider as well. So this is how we are engaging with care providers. We have 38 providers that are interested in piloting this. The thing is being prototyped. iDecide is being prototyped right now, but there's been a lot of interest, especially amid COVID, because as we're limiting some of these in-person meetings and shifting more to telehealth, people are very concerned that they don't want pregnant folks and postpartum folks to fall through the cracks. So we have some preliminary data. This is all self-reported. So, ideally, eventually we'll have a more robust study. But after they have used the parent app, we ask them lots of questions about who they are, what was important to them, what they planned, and how that compares to what actually happened during their birth. Cesarean rates, overall users, we have 4% lower cesarean rate than the national average. Black users have a 9% lower cesarean rate. And our intervention rates compared to listening to mothers in 2013, we really looked at inductions and epidurals, and we had a 3% better induction rate and a 28% better epidural rate. Lower, I guess better is kind of judgy, but lower induction and epidural rate. So our business model is parents can either directly come and pay for the app, that's $50, to use our software, access the dashboard and all of our content. We also have a partner program that is mostly doulas and childbirth educators that use our tools with their families, and they also pay for families to have access to the parent app, and then also licensing content to other entities, which is something that's in progress. Our team is pretty awesome and diverse. We have midwives and childbirth educators and doulas. that are really committed to, diversity, inclusion, trauma-informed care. And we've had a lot of traction in the past, I guess coming up about 2 years. We're a pretty new company, but we have 800 plus total app users. We have 515 partners, which is all of those professionals that are using our tools. 145K in revenue at 38 pilot sites, like I said, lots of strategic partnerships in the works, and lots of really positive reviews. So where we're headed next is we are moving our childbirth education portal to the app, and also creating a dashboard for hospitals, providers, even employers, anybody that wants to provide our parent app to families in their organization, that they can invite families directly from the app without having to give them like a coupon code, which is what the solution is right now. So yeah, this is just a recap slide. That is the overview.
That is a ton of really exciting work.
Thank you.
When you started out developing this idea, was your main intention to be working directly with pregnant people and their families, or to be working more directly with providers, or did you always envision it as a communication bridge between the two?
Yeah, definitely. I think initially 7 years ago when I started working on the idea, it was with parents and that direct-to-consumer idea first in mind. But as we built it, and we're really looking to outreach and scale, it's really hard to get pregnant eyeballs at the right time, because if we're focusing on decisions they're making during their birth process, we're really only relevant for maybe 3 to 6 months of their journey. And we have 100% churn rate because nobody is pregnant forever. So we launched, and the feedback that we got was, people from my community, doulas, childbirth educators, midwives, care providers, that were like, this is so cool. How do I give this to the families that I serve? So then we really morphed into, having professionals sign up and deliver our tools within their organization or their practice. So that's been the majority of our revenue. And a lot of the parents that are on the app right now are invited through their doula or provider or whoever. So that's also more sustainable, because these professionals are going to be using our tools year after year. So that was how that shifted. We are looking to engage more with pregnant folks directly through some partnerships with fertility apps that we have relationships with, because they are very much upstream. They're engaging with them before they even pee on a stick, So being able to partner with them and deliver content and build that relationship as early as possible is really important.
What have you learned through the process of doing this? Like, what have been the main needs that have come up from your direct consumers of the families and the providers, the educators?
Yeah, I mean, I think that the needs from parents are, a lot of times they just don't know what they don't know. So it's kind of finding this balance of meeting them where they're at and giving them what they're looking for online and what they're asking for, but also being that gateway of like, hey, have you considered this? And this actually might be important and really impactful for your birth experience. So kind of being that guide and that mentor and that bridge for what parents are looking for. And then the needs from the professionals really is there's a lot of outdated information out there as far as childbirth education materials. A lot of them look like they're still from the 80s. We've got the unitards and everything and the big hair, and they're not necessarily very racially diverse. They're not necessarily focused on trauma-informed care. They don't use inclusive language, which is something that we're very committed to. And something that I've appreciated even in talking with you, how you're using pregnant folks and all of that, very much wanting to be on the forefront of engaging with all pregnant folks. So the professionals that are signing up for our tools are really on that forefront of wanting to be inclusive, wanting to reduce disparity, wanting diverse content that shows lots of different types of families, and wanting just something fresh and new. And very visually stunning, because I am my training, I'm originally and always at my core an artist. So our tools are very bright. They're very visual. I've done about 300 medical illustrations for this project. So yeah, just really focusing on having a really bright interactive experience.
So to you, what would be success for this project?
My heart, and I know the heart of my team, is really impacting disparities. And so it's sometimes a bit of a catch-22 of having a technology solution and then having marginalized populations that don't necessarily have access to reliable Wi-Fi technology, all of that. So success for me would be to have parents really coming through their birth experience, feeling like they were respected and honored, no matter what that journey looked like, that they really felt like they were an educated, involved part of that experience. And that also that we have better collaboration with care providers and teams. I feel like as a doula, I love doulas. I think doulas and childbirth education and birth plans are awesome and impactful, but they're not going to have the type of lasting change if they don't engage and interact with care providers. So, you know, having better collaboration and less of an us and them, sometimes even manipulative situation in the birth room is really a focus and a passion for us. And then just how that looks like on paper is, you know, lower primary cesarean rates, lower intervention rates, higher satisfaction, less birth trauma. All of that is really how we would measure success.
So now we've been talking for a little bit and people are really excited about this innovation. If they want to learn more, how can they? Where should they go to find out more about this app?
Definitely. So our landing page's website is motherboardbirth.com. And then under the menu, based on who you are and what you're looking for, we have a parent section that outlines everything for the app. We have a birth professionals section that has the partner program. You can also pick up app codes if you'd like for your own clients. And then as far as iDecide goes, you can sign up to be one of our initial cohort for iDecide once we get all of those ducks in a row. You know, that's a big part of the question mark for us is just how it really inserts into clinical practice in a very realistic way. So we're excited to partner with folks in that area. So depending on who you are, you know, you can kind of figure out what you're looking for on that website. Follow us on the socials. We're on Facebook and Instagram primarily. So share lots of really awesome birthy content that you can add to your own walls and all of that. So yeah.
So, and back to iDecide for a second. So iDecide is not available yet. You're about to prototype it and get feedback and see how it's going to work.
Mm-hmm.
What exactly is your vision for what iDecide will be able to do?
Yeah, definitely. Well, I think a huge pain point for care providers from what I understand talking with people is that time. They often are juggling so many patients in a day, so many patients on the floor, and you know, there's not necessarily a ton of time to explain exactly what an intervention or exactly what their body is doing in a very in-depth way. And so when you only have 5 minutes with somebody, you're kind of going to default to saying whatever you think it is you need to say to get them to do what you think they need to do. And that can sometimes cause conflict or trauma with birthing folks because, you know, they might have more questions or not understand or feel like they're kind of being pinned into something, whereas if you had some tools to help them understand why you want to take this course of action, I would assume that most parents would be like, okay, that makes sense. And then there's buy-in because they really understand what's happening and are able to ask questions. So the time element, we're really kind of leveling the playing field and creating a foundation of education of what this thing is, why it's used, when it's used appropriately. So then the care provider can take their valuable time and really focus on answering questions that are specific to this person, this family's health, their baby's health, and not have to teach a childbirth class at the bedside because a lot of people don't even understand their own anatomy or what's happening to their body. So the parent app and the childbirth ed stuff, that's really great prenatally, but the I Decide tool is really in the moment trying to reach all people, no matter if they've hired a doula or taken a class or anything. Like what is the information that they need to make this decision? And then of course all the other stuff with discharge and postpartum as well.
A question that's going to be germane to other folks working in this sphere in this day and age. How has COVID impacted your motherboard birth project?
Yeah, definitely. This is odd to say. I don't know if it sounds bad, but it honestly created a very real need that we were able to step into, because a lot of hospitals canceled all of their in-person childbirth ed classes. And we were already in the process of creating the childbirth ed portal, which I can also show if you want me to share my screen again. But, you know, they basically canceled all their classes, and people were realizing that they needed to take their stuff online like yesterday, right? So people were scrambling. We really accelerated our launch for the childbirth ed portal to fill that need, and we've had a lot of traction in that respect. A lot of people using our tools to create online classes, pre-recorded classes that can meet families at any time, day or night. So yeah, I think that we've been able to really step up and fill that need.
Show us the portal.
Alrighty, let's see, I'm gonna get my tab all set up. Okay, so this is our childbirth education portal. They can buy app codes, they can sort based on the type of module that they're teaching. Let me move my Zoom window over. Okay, so these are the different modules that we have created for educators to use with families. So, you know, it's kind of broken down by, you know, pregnancy, labor, birth, and then also postpartum. So when they click on one of these modules, what pops up, for example, is this physiology of pregnancy and birth. What's included is there's an educator guide. So that would be information for the educator about how to really teach the class, some homework ideas, some engagement ideas, also adding context if you are, you know, dealing with folks that are trans or gender nonconforming, if you're dealing with folks that are, you know, Black, how to, like, what are some of the implications of this information and how can you be really sensitive to that? There's also a class checklist, so they can take notes on that. There's a parent handout that they can share with the families that are in their class, and then they can also download the slideshow if they don't have access to Wi-Fi. So they would be able to bring this up full screen and go through all of this lovely information broken down by different sections. Again, these are all my illustrations.
Beautiful.
So thank you. Yeah. So this is just a way for them to teach the class either virtually or in person if they have access to a monitor. So yeah, this is the educator portal. Any questions about that? Sorry for the unsolicited crotch shot right there, but we are talking about the physiology.
That's the way it goes.
Well, a lot of people don't know that they have 3 holes. Let's just put it that way. Yeah. So we broke these modules down smaller so that they can really piece together what their community is needing, instead of just having here's your pregnancy class, here's your childbirth class. It's a little bit more customizable, if that makes sense. And we're looking to create these slideshows as editable so that hospital systems, if they wanted to co-brand or edit some of the information, add some things that they offer at that specific location, etc., they're able to do that. So that's in progress as well.
I am heartbroken to say that we've extended over the time that I said that we had together. But in wrapping up, what are the key messages that you would like folks to know about Motherboard?
Definitely, that we're really committed to helping all families become a really engaged, informed part of their birth experience, as well as partnering with providers to engage in their care with families in a new and innovative way, and that we're really passionate about reducing disparity and impacting things at a systemic level with our organization.
Thank you so much for your time. Once again, for anyone listening, if they want to find your website, it is
motherboardbirth.com.
awesome. Have a wonderful day. Thanks, Amy.
Thank you so much.
Yes, I want to stop.